That's just 75 minutes, so 150, so that's for vigorous. Usually, the 75 to 150 of vigorous, we always check patient's history. So sila yung mga very active, let's say for example, triathlete siya sa una. Or until the age of 70, o weight-lift pa siya. O gym siya every day. Nang able, pag-develop to do physical activity. So pwede na sila mag-push. Okay, shorter duration but vigorous ang intensity for that one. Pero for the general population, so longer duration lang. Pero syempre, meron iba nga you cannot push. Again, sulit-sulit lang na kay Miss Jessa na wala tayo pilit kay patient. Okay? At dapat niya hambal ni Miss Jess yung mga 2 hours kagid niya lolaya. Okay? Feeling ko sa 30 minutes kagid ko to. Ginahagal na si Lola or si Lolo. Okay? But remember, this is in a week. So meaning, you can distribute. Okay? As long as maka 150 minutes siya to 300. Okay? Within the week na siya. Sige. Aside from aerobic exercises, if we can engage them for muscle strengthening activities, does it have to be nga ma-lift sila weight? Diba? Isometrics will do. Or, if we can incorporate, diba, we could improvise. Lolo, does it mean na makatogit sa gym dapat? Kumiyara ka na, diba, water bottle? O, pwede na siya. Dumbbell na siya. Or, diba, body weight, squats, pwede naman na siya also. As long as they are able. That's why we also do environmental assessment. We do not push them to go to the gym again. And then there are times in which there are some instances in which you're not able to afford physical therapy. So we give them home exercises that they can do. So ma-improvise lang ka. Okay? Sige, so again, you can also incorporate as part of their ADLs. On this one. Lola, galaw-galaw pag may time. Kung may mga zumba-zumba ng activity sa community, pwede kita ka-join si Lola o si Lola. Or, let's say, married sila, pwede din nila quality time, walking sila. As long as may incorporate siya with their ADLs. So, sa second, please determine their level of effort. Kung halin sila sa sedentary lifestyle, you do not expect them na mag-join na tayo sa 5-kilometer run na marathon man. Diba? Ang iban kanina healthy, 5 kilometer ayaw, mas like if they did not train for it. Okay? So medyo matamat. So pwede nga lola walking at adik sa sulod balay, and then eventually sa sagwa balay, and eventually pwede ka nakalabot sa piyak na street. So determine their level of effort also. Do not expect them nga, pwede ka na dahil ka dumbbell. Okay? Wala kang nag-assess MMT nila. On that one. Sige, older adults with chronic condition, so always check. So ina-regulate na yan, hindi man niya basta-basta. You already know that. So again, we also emphasize on safety, always. Sige, example of physical activities for older adults. Siyempre, this one is by the book, so mayroon na din na-include ng activities which are applicable outside the Philippine setting. Okay? Pero this one, aerobic activities, walking or hiking. Pero wala natin kung nakita yung mga lolo-lola na super hike, nagsakak sa mga bukid-bukid. Except for those who were into it at a younger age. Dancing, very common. Mga zumba-zumba or iban, mga ballroom dancing, they're still into it. Swimming, recreational, or wala naman din silang competitive type. Water aerobics, omnihambal, kung sino pwede, di ba? Isa sila ka-group, tapos ikaw ma-supervise, o that pays well in one session lang. O that one. Jogging or running, jogging will do, you don't need to force running, or aerobic exercise. Some will enroll in yoga, some at an elderly age will enroll in Pilates, and that one. So bicycle riding, especially for mga elderly men, who are athletes or very active at a younger age. Pero very common na rin lang. Yard work, gardening, very common. Matanong-tanong sa mga vegetables or take care of plants. That's still activities. Pero, syempre, we need also to educate, especially mga proper body mechanics. At ikaw mong kudo-kudo, si Lola, gardening, tapos nag-bend from the waist, tapos pag, hindi na siya mabalik. O, di ba? We need to consider also the other physical attributes at that age. Sports like tennis or basketball, common pa man siya sa mga lolo, mga sige pa yung basket, very competitive pa sila yan. Okay? Walking as part of golf, although medyo limited siya, especially for the elite. Ang golf, kasi expensive mo siya. Muscle strengthening. So, we can have them enroll sa gym if they're able to perform, but if not, we can improvise. So, pwede lang siya mga TheraBands, light weights, or do not expect them mag-barbell, mga kettlebell, and all. Okay? So, body weight, push-up, modified push-ups, and that one. You don't also expect them to do 1-minute planking. Bukabuguro ng 1 minute, I won't expect mga tanan kaya niyo for 1 minute to execute also. How much more, okay, for the elderly? Digging, lifting, carrying, gardening, still the same. As long as kumayari sa equipment's gonna use. Because the equipment will serve as your resistance. Okay. Carrying groceries, bukat na siya gan. Do weights lang na siya. We're still ina-incorporate na siya gyapon. Okay? As simple as that one. Okay? Ang very common yun is your Tai Chi. Okay? Sa spoy, amuin sila yun. Especially sa mga elderly. More siya stretching, strengthening siya, and relaxing also in a way. Okay? So CDC, Center for Disease Control and Prevention. So ang option na is, amo ni siya, di ba? We discussed that. 2 hours and 30 minutes, 150 to 300. So distributed for the week, so dapat moderate lang siya. If you go for shorter time interval, so amo na ng vigorous siya. On that one. And option 3, so pwede ka both moderate and vigorous nga aerobic. So pwede mo siya ma-alternate if you want. Kung very active ang elderly patient. So pwede nga ang imong rest, amo na siya doon moderate. Let's say jogging ka subong, pagkabuwas, o pwede ka na ito bicycle, for example. Again, very limited lang ang elderly patients for your option 3. At least, okay, for option 3, pwede na siya as a form of progression. Okay, di boring man for them. Sulit-sulit, walking lang na walking. Okay? If limited siya to ambulation only, what we can do for progression is change of scenery. Kasi una sa sulod balay lang. The next nagwa balay. O, tapos next, mama pa NGC ta. Libot-libot na sa fountain. O, I did that. Hindi gusto na sa patient magwa. Or after that, o nangaga si patient, makatuta doon sa bukid, o lakata sir. Diba, dalalagaw na. At least nagwa siya, tapos, diba, naglakad-lakad man siya, abhir, nakapoy na ko siya. Sige sir, pag-huway ta. O lakata na, o balik, o diba? Or at least, ni-harder ka pa activity. Okay, as simple as change of scenery, change of, what do you call this, terrain. Okay, that's already progression for them. Okay, so medyo hapos lang in a way for the elderly, but very, grabe ang patience for the PT on this one. Okay? So, we could also educate them for consequences of physical inactivity, such as, di ba, there's health risks, pwede deconditioning, especially kung super tikulang mahit on that one. Again, no need to threat them on this one. Kaya basta hindi na kita sila karoon or basta nakulbahan sila kung binadag. Hindi mo na gusto. Medyo naman na siya. O diba? We could have patient education for these patients. Ma'am, pwede ka maka-develop low back pain, pwede ka magka-acquire pneumonia if higda ka lang yun. So dapat mabangon-bangon ka man, walk from time to time. Okay, very common, mabatian mo nga. Basta ikaw rin magpalanigaan na dahil mo mga joints. So, dapat na exercise, stretching on that one. Okay? Sige. Advantage lang siguro the PT part is we could only do so much for them. We cannot really force. Okay? You need rest intervals. You cannot have the continuous type for the elderly. They would require the interval type of exercise. Dapat may rest din yan. Sige. So we have certain terms here. First is your sedentary death syndrome. Uy, man talaga ba mapatay? Kasi yung meron sila inactivity. So, ang nila lang very common is your deconditioning. So, di ba, mas dasi mag-deteriorate. Okay? Cardio-respite functions. Okay? And then, your muscular needs. Pwede mag-atrophy ang muscle, which will lead to weakness. Which eventually, pwede siya consequences, they'll have difficulty with ambulation. Mag-very weak sila. Okay? So, mobility disability is the inability to walk 1/4 of a mile or to climb a flight of stairs. So if you notice, there naman ma-include ng mga metabolic equivalents na also to check for these patients. Okay? You've tried mangguro, di ba? Nung wala klase, lamig-lamig. Tapos, nakatulog ko. Let's say, natutulog kagabi, nabugta ko yan, 2 o'clock na sa hapon. Pero nga, why do you feel tired pag nga dumas, feeling mo ba di mali pag imagine ba na for, let's say, 12 hours, na wala ka activity, pagbugdaw mo sa siya gagawin, mas nagsalalakit pag ang lawas mo. Yes, naka-rest, but again, prolonged immobilization can have deleterious effect. How much more for the elderly, in which their functions must get lesser or deteriorate. Okay? Sige, we have this slippery slope of aging. So, ang vigor nila compared to age. So, sa mga 20s ka pa lang, di ba? Grabe, yung energy. Tanang-tanangin ka, makadota to, go, makadota sa muni, go, matry ka muni, go, di ba? Tapos, eventually, so fun, function, frailty, and failure. Okay, very seldom yung galabot mga 100 plus, na very active pa. Pero how do we differentiate? So, for fun, like in your 20s, where you are now, so, you can do whatever you want, wherever you desire, as long as you desire it. Ayaw-ayaw pa. Because you're physically able to do it, you still have the resources, you still have the time. Okay? So, sa function, eventually, mag-30s na, so let's say, work na ka mo, okay, or gawin na mo ng work, or review or ano, so mag-change na siya. Because meron ka na mga priorities, or meron ka himuon. So, you still have the desire, but you don't have the time for it, so malesen na siyang activity. So muna, let's say, gargan ka pa every day. So now, mag-work ka na, hindi ako karan, kasi may shift ko. So malesen siya, for example, makad-shot. Until eventually, for frail na, so those require help with IADLs or your basic ADLs. So medyo tigulang na, may mga comorbidities na. So hindi ka na mag-expect, especially nga, ay wala naging ko time, kami kids na ko. So instead nga, i-jogging ko or i-run ko, so ibantay ko sa bata ko. Okay? So meaning, activities become ADLs na lang. Until eventually, for it, the results of inactivity na gid, or kung nagtigulang na gid, mag-failure na siya. Usually 80s and above na siya. So, completely dependent. So, pwede siya nga assistance from a person or dependent on assistive devices on that one. Or some, the conditioning, so they get bedbound. Especially if may mga comorbidities. Let's say, nagka-stroke. Pagit sila, mga muna. Okay? So, for geriatric, our key factor to identify is your leg strength. Kati more kita on ambulation. So kung very weak ang legs, so you would expect na problems also. Difficulty with your ambulation. So si leg strength ang atong nabasihan. Okay. Sige, so si frailty na diba? Those who would require assistance. So according to CDC, how will you know? Ang hard na siya sa frailty criteria. So ako ni siya. Okay. So, pre-frail siya if 1 or 2 ang iya nga out of the 5. 1 or 2 out of the 5 pre-fail. Pero if 3 and complete, 3 to 5 media, so frail na siya. So, unintentional weight loss of 10 pounds or more in the past year. So, meaning, ka-atrophy na ang muscles. Okay? Diba? Remember, if you go to the gym, you don't expect, let's say, especially if the-lift ka mo, you don't expect hanga mamag-add ka mo. Okay? Even if you ask coaches, dapat nagbug-add ka mo yan. Because, di ba, nag-increase in your muscle mass. Except if you go to the gym, wala kaya nag-lift, your goal is for weight loss, then you would expect weight loss. Pero if you do mga lifts or weights, dapat ma-weight gain ka man. Okay? Nag-lose na yung fats pero i-weight gabugan ka dapat. Muscle weakness, especially with grip strength, self-reported exhaustion, naglakad lang siya sa sagwa ka, nagbalik, ginhapon na siya. So, you would also na-include naman nila mga RPE stuff, rate of perceived, okay, exertion. See, walking speed is slower. That's why you need extra patience for them. Di pwede, sir, dali, sir, dali, sir. O, di pwede yung nadali-dali sila mag-walking. What if dali-dali nila karoon na ang balance sila? O, di ba? Ikaw pang cause. Okay? Low level of activity for that one. So, makita ang video nga doon nag-deteriorate ilang activity. So, considered frail na sila. Okay, sige, we have a lot of balance measures since leg strength is our indicator, greatest factor. The first is your Romberg test. A quick review. How do you do your Romberg test? One leg stance. Closed eyes. I know that. Closed eyes, one leg stance. Are both feet. I know. Hambal din ako na both feet and then on the ground and close eyes, then i-challenge. Ano? Ayan o. Matitag lang siya ng close eyes. And? Tight. And then you check for swaying. So kung ako tapos sway na si Miss Jess. Kasi tingin ako. Yes, definitely is for balance, pero not there. Standing balance with feet together. So what are the activities needed? There. Eyes closed and hands crossed. Diba? For 30 seconds. Equipment required, check to. So i-time nyo siya. So stopwatch na yun. So interpretation. So, check that if may sway na siya. If may sway, loss of balance. So, positive na siya for Romberg. So, meaning, if positive for Romberg, there's already sensory loss distally. Kasi ba we can find at the mga receptors, proprietary receptors, especially the feet. Okay? And when that happens, so you also check for distal sensation. Hindi siya ka-feel na. Hindi nga affected na yung mga proprietary receptors. Okay? So, easy to administer, simple, and safe. O, syempre, dapat already ka ready to catch if mag-sway or ma-lose balance si patient. So, the main use for this in older adults is to detect distal sensory loss. This one. For older adults. In general, sa Romberg, for the general population, so for balance, pero sa dili, gamiton na siya para ma-identify na ang distal sensory loss. So for proprioception. Next, your tandem or your sharpened Romberg test. Anong difference niya sa Romberg? So naka-anteroposterior na siya, hindi pa naka-paralyzed. Okay. Again, so this one, still for balance. So then, one foot in front of the other or naka-anteroposterior. And then, still the same with the eyes closed and naka-cross. But this time, longer siya. The progression siya, pati sharpen siya. It's now for 60 seconds. So still the same, stopwatch. Okay? So difficult to perform na siya in older adults. Kaya di may iba, no okay, that's a Romberg. So ma-progress na to this one. Okay? So wala na yung gahambal, ang hirap magbudlayan kasi lahat on this one. So we just need to check. If they're able to do it, so better. Standing in. Meaning okay, ila sensation, okay, ila proprioception. Okay. So this one, for tandem Romberg, still the same. Do the progress ng ginsayan. Okay? Sige. Next, your single leg stance. How do you do this? Stand on one leg, eyes closed. And this one. I know. Progression na. Eyes closed or eyes open for your single leg stance? Eyes open. How about the hands? Side. Adin, is it A, is it B, is it C? C? I still the same. Pero one leg lang, nakamula na gapon. Pero this time is eyes open. Kapag yan yung gisyo, naka-eyes closed dito. Kung sa Romberg lang ayawan na siya, tapos subukan, hindi pa single leg siya. Okay. Sige, mga, at least naka-review that. So again, still the same. Stopwatch, this is for 30 seconds. So, sensitivity of 95% according to research, specificity of 58%. Okay? So, very careful lang ito name since it's one leg. So, if they lose balance, so ready to catch lang ito yan for safety purposes. That's why for precautions, with the risk for falls. That one. We do not take for granted. We cannot use when we also the gate belt. Kaya titayak na karoon, hanggang muna siya. Kumaga muna, putumunta. Diba? So, ma-perform yun na karoon. So, wala lang ito yung equipment, even the gate belt. Okay, pero ready. So, meaning to standby assistance na. Okay? So, this one, main purpose of this is to examine lower extremity strength. So, we usually try to test for both. Unang right tanay, and then si left naman. Okay, para ma-identify that if may laterality issue also. Let's say right is stronger than the left lower extremity. On that. At least you could work on the right if weak man siya. Okay? That's for single leg stance. And next, your functional reach. How do you perform this one? Anong position ni patient? The stand. And then ma-reach siya, patiin. Forwards. Pero ano ang setup sa environment? So, ma-stand lang kapag ma-reach. Okay na na? So, wall. Ayun ba? There's a wall. And then, so for this one, measure, and then for each, then measure also. So measure from the initial up to the initial reach. There, standing while reaching. So dynamic siya because na-move ka. Standing and reaching forward. So this one, the yardstick, meter stick, measuring stick. Kung wala, tape measure will do. Okay? Pero very bad, fix on the wall na siya. Okay? So nakatapik na siya, pero well, kung initial, let's say 10, pag reach, let's say 20 siya. Okay? Pero sa atin, di wala tabi nga naka-fix siya sa wall. So ginamark na lang ang initial and where siya per reach. Okay? So if the reach is less than 6 inches, so there's higher prediction of falls within the next 6 months. So lesser. Hindi kung lesser, lihiya mo na, meaning try siya pugo para ma-maintain yung balance if less than 6 inches. Okay. Safe siya, kasi syempre we are assuming the PT is well prepared to catch the patient. So this one is to assess the maximum forward reach. Okay, to challenge your base of support also. And will include, so this one you could use for falls assessment. If less than 6 inches according to the interpretation, within the next 6 months, may higher probability na pwede matumba si patient if unassisted. Okay? And next, your multi-directional reach test. How do you do this? Line ng direction, pero area po sa wall. Forward. Anong side? Side. Correct. Multidirectional yung forwards, sidewards, and backwards. Di ba? So, four directions siya because forward, backwards, right, and left. That's why it's four. Okay, but doesn't have to be yun hanga sa wall siya. Just need to check. Okay, wala nang taga. So, ga-measure lang ta if we want to, as reference lang. Let's say, pag first session, di. Pagka second session, nag-uum na lang na. So, there na lang taga-try to measure for reference purpose. So, yardstick to measure. Okay, so interpretation of scores, the lesser the reach, higher risk for falling. Because that the reaching on all directions will alter your balance ang base of support. So kung mas lesser, meaning mas nakubaan sila to reach. But reaching forward, kasi matumba ako. So maamunan ko na yan. Hindi ko yung try to reach it. Same with right, left, and backwards. Sige, so this one provides insight for risk of falling and to test for dynamic standing. Okay, so in a way, wala tayo makita ang gag-give sa perseverance na. So siya yan mismo, iya own. Okay, nga dynamic movement. Next, FTSST, 5 times sit to stand test. So, how do you do this? Sit to stand for 5 times. Pero ma-end siya with sit or stand?
Stand.
Ma-start siya with sitting. Ma-end siya with standing. Okay, sit to stand. Pero, with the question as to how many times, so that's 5 times as quickly as possible. 1, 2. So, ginatime ko siya. So, chair and stopwatch, how long is he or she able to do the 5 times na sit to stand? So, hasta lang siya mag-time, tas lang siya sa stand, wala namang balik back to sitting. Okay, ko, naka-do 5.5. So, sit to stand. So, pinaka-last is ang stand. Okay. There's interpretation. So, this one, for older adults, so this is a strong predictor for falls. Okay, this one must alter pag ito sa base of support and there's change of position. Okay, as simple as sit to stand, we could already try to detect risk for falls for the adults, especially ang mga community dwellers. Ito meaning, ga-ambulate na sila outside their homes. Questions? And, sige, so for your physical stress theory, sige, basic naman lang even in your physio. Too much stress will lead to injury. That's why, diba, always check for the current effort, current state of the patient. Okay, so kung kita nyo, EMMT, ang wala nito, expect na makakapatulong siya na yun. Okay, pwede magka-muscle tear, for example, kung hindi niya kaya. Okay, appropriate overload for strengthening. Usual stress, diba, just like your PROM, or even AROM, diba? Limitation of AROM, it cannot strengthen already strong muscles. So, kung usual lang mo niya, don't expect na ma-increase ka sa strength. Too little stress or inactivity, so atrophy. No stress, so eventually, pwede nga, would lead to deleterious effect, loss of ability to adapt or tissue death. Sige. So for this one, hindi nakapagusto lagi. Especially for those na may mga comorbidities. So we need to have medical screening or clearance. If meron siya comorbidities, clearance from all the specialists. Cardio, neuro, nephro, if there's a need. Okay? Siyempre, informed consent sa mga tigulang that will protect us. Yeah. Okay, mahambal nga. Ma-change na talaga sila progress. Kung ma-change na ito, makatulad ito sa mga bato-bato. Tapos natumba. Nag-sign ka, di ba nga nag-okay ka. Na ma-ambulate na tao on rough terrain, for example. Uneven surface. Okay? Do not forget to inform consent always because that will back you up just in case something happens. Although we're not asking for it. Okay? Check for baseline functional capacity. That's why we check for baseline ROM, MMT, vital signs kit. Consider the mode, intensity, frequency, and duration. So you already know. So So this one, di ba, wala kang very specific parameters as long as you can play with it. Inversely proportional lang yun. Wala nang rule ka. The higher the intensity, ano dapat ang duration? Lesser siya. Pero kung lower intensity, so longer ang duration na. Gradual progression. You do not expect na mag-progress ka mo every week on that one. So, longer siya actually rehabilitation for the elderly. Very important is the safety at all times for both you and the elderly patient. Motivation, na mo gining medyo budlayenta as PTs. So, that's why aside from patient education, that's why we could play with our environment. Kaya tilisin na mulingan, siya yung na-confine nung siya sa rehab. So pwede, kag sige ma-change the venue. Pero ma-exercise kayo gyapon. Okay? Pero syempre, within your ano lang ha, make sure ya ha, okay kaya to conduct your program if there's change of venue. And then regular re-evaluation. Sige, mga exercises daw. Overload principles, still the same. If you think, di ba, wala na siya or nag-plateau na siya, syempre, you would progress. Okay? Amo to kaginang sa physical stress theory na. If usual, wala kaging progress. That's why you would need to do strengthening. Okay? Again, for this one, so, di ba, depende. We have 3 goals. To increase strength, increase endurance, increase power. So si power, usually wala na yan for elderly. Iti ang nagiging yung purpose niya, hindi niya gina-increase yung power, technically. So strength and endurance, kita more focus. Again, little progression, still progression na siya. Okay? Sige, so again, with this one, always go back sa inyo RPEs, on this one ha, and it will include lang sa inyo activities, your talk test. Nung like habang nag-iwo ka mo, diba? So kung hindi na siya kaginhawa, or let's say, able pa siya yapon to converse, or makasabat na lang siya 1 or 2 words. Okay, we'll always go back ha, sa inyong rate of perceived exertion. Very light. Okay. Sige, quick review, what's your specificity principle? Specificity principle. Specific meaning. I'll give example today. Specific exercise for the patient.
Visualize a treatment.
The patient who is physio patients.
For Jerry, yeah.
For Jerry, we give specific exercises. Basta specific.
Specific siya for the elderly. Sige.
But
Individualized. Yeah, technically all individualized na siya. Di ba? Specific siya ganyan. For di ba, ang best example na, if you want to develop your biceps, syempre yung bicep curls. Hindi pwede nga mag-squats ka. Paano naman develop ang biceps if you do the squats? Because the squats is for the lower X. So same naman siya also. That's why we need to identify kung anong gusto mo nga goal, ang mo nang himuon mo specific for that one. Pero in general, let's say you want to develop for endurance, so pwede ka ka-ambulation for a longer period of time. Siya. For strengthening, so meaning shorter duration, ambulation, for let's say pwede ka kaputang mga ankle weights. Siya. So again, we always go back to our goal para mabalata kung anong specific na that. Okay? So, this one, you also check. Are you going to do concentric, eccentric, isometric siya, yung exercises. So, let's say you're trying to protect something, let's say mayroon siya ADCAP. So, hindi siya pwede ka move, or hindi tayo strengthen, di ba? Ang distal, pwede tayo kang ano. So, if we're trying to protect the shoulder, you could do isometric. So, wala lang tayo concentric, eccentric, yan eh. That one. So we also consider that one. Sige, let's say your goal is to increase ability to get out of the chair. Ano yung mga assessment or outcome measures you can use? Okay. Sit to stand, pwede na siya. For example, kung mo na, kung mo na stays. Ano kailangan mo to get out of the chair? Ano ginang very basic? Upper X, strength. Push. LE strength. LE strength for anong specific motion? Hip extension. Hip and knee extension. Sige. Hindi mag-move ang chair. Sige, try to get out of the chair. Haba ko na hip and knee extension. Sige, go. Nakagawa si Stacy, wala. Hindi pa rin move ang chair. For example. Anong pwede na mag-move? Pag momentum. Trunk. Scoot forward. Ang keyword na mag-get out of the chair siya. Mag-walk siya sa chair. Clearance. So, kung i-clear tayo, ang example, this is Stacy, ha? Kasi example, kung sila ni Ray, mag-clear sila yan. So, pwede lang kaya na sige, Ray, kung ikaw ni Ray, hip and knee extension daw. Nakaya niya. Yes. For example, kay, sorry, hindi ko super na. Idug-idug tayo, for example. So, paano siya kagawa? Clearance for going where? Specific motions. Okay, specificity tayo. Upward. Say upward. Mag-upward, upward. Yes, upward. Backward. So, yung picture backwards. Push niya. Ay, balita mo na. Sige, there. Kasama na ako. Sige. Kung mag-hip and knee extension ka, kaya medyo good life. Sige, try to get, saan mo na mga position specifically? Try to get out of the chair. So ano to? Kung mag-get out of the chair siya. So very specific. Hindi pa ito try lower X, ito nga ano. Ito na siya. Yes! So yung first start, we need adaptation. Hindi kailangan siya mag-get out of the chair. So i-clear niya, get out na yun. So mga amo na lang specific. Example lang kaya, ganyan ka muna. Pero kung magbuwa siya, so medial naman, that's in hip abduction siya anay. That one. Okay. Sige, this one, just to help you lang, so we have tables. Let's say your functional movement or transfers and squats. So, key muscles for specificity ni siya. So you need your GMAX, your GMED, your alternate externals, performance, and your quads specifically. So, exercises that was sit to stand, squats with knees abducted, hips externally rotated, leg press, wall slides, in order for you to do that. So, ano siya mga hambal na very specific siya, or specificity. Okay? And then, you can try to progress. O, diba? May pa si Lola, kaya niya mag-side plank. Diba? Sige, here, for this one, which also applies even for mga hindi pa elderly. If you want the patient to do something, basta make sure na properly executed siya. Kaya like example, may iba nag-push-ups. Pag pinagusto lang push-ups, pero sila ang form. So, risk for musculoskeletal injury and defeats the purpose. So, kung hindi niya kaya ang full ganyang push-up, diba that's why you have modified. So wall push-ups or ang nakabed ang knee, ganil siya. Still the same naman nagyapon ng target. Okay, which ako lang nagaling ang wala gina-give into details of coaches. Okay, wala ko sila yung ginagubaan ha. Pagkati, di ba, if you really know, so you can try to modify, kati same lang ng target muscles. Di ba now, mo nagagawa reels, what you can do in the gym, you can also do at home. You just try to alter the position. Same lang gyapon ang target muscles. Okay? Sige, functional training. So examples, if you want to improve transfers, improve outdoor ambulation. So again, for functional na siya yan. So again, we could incorporate with activities of daily living on this one. So again, let's say for example, sa ilang case, frozen shoulder. Okay, so usually ano nga motions ang putlayan din. ERN? You're a bear. Muna. Di ba? So, if may mga difficulty, so pwede ito siya ma-incorporate. Let's say, di ba? Try to brush the hair. Okay? If you're going to put on makeup or if you're going to brush the teeth, use the affected side para ma-abduct siya, mga muna. So, anything that you could incorporate sa ADLs niya. Speed and power, although very seldom, wala tayo yung paamugin niya. Kung gusto gitya ni Lolo or ni Lola, very active pa sila, very strong. So we do not restrict them also. Okay? So types of contraction you consider, again, kindly check. If you're trying to protect something, you could do isometrics. If not, so you could do your isotonic, concentric or eccentric. Sige, motor learning. Since elderly sila, we're not assuming nagkalipat-lipat na sila dahil. Pero di ba, minimum of 6 weeks achieve true strengthening in muscles. So, you can have different types on how you're going to introduce. Okay? So, type of practice, kung block, so lain sa D1, lain sa D2, lain sa D3. So, when you say it's a series, so meaning 3 siya all on the same day. Pero inapasundod mo lang siya. And then eventually, you can progress na to your random type. So usually, we first start with block. Isa-isa ko ng anay. Let's say, for example, i-introduce ta anay si hip flexion lang. And then pagka the next day, si knee flexion lang. Until sa third day, so both na, naka-squats. So pagka ma-progress ka, so pwede na siya ABC, anay. So hip flexion, knee flexion, squats. Pagka the next day, until if ma-master yun na, so then, this is the type that we use, a random, to check na. Okay, so pwede na siya. Kumbaga, mastery na. Isa mo sa mo na siya, kabalo na ganyan si patient. Okay? So again, repetitions first before your mastery. Wala man na first pa lang introduce, gets mo na na yun. Hindi ka na magbalik. Okay? So mayroon man iba, that's what they do, especially outside the Philippines, and very common sa Australia. Okay, kasi very limited lang ang session, let's say 30 to 45 minutes, there's little that you can do. So sa first, ang imo lang nila is, let's say assessment or let's say flexion lang tanan. So hapos-hapos lang yun dito sa sagwa. So flexion lang. This is what you will do, ma-assess ka, and then I'll teach you flexion. You do this 10 times. So you do it in the morning, you do it in the evening. Sa elderly niya, specific ha. And then, syempre, kasi limited nila endurance also. Sige, I'll see you tomorrow or I'll see you Wednesday. Pagka Wednesday, i-check mo mala, how's our flexion? Okay, so now, you've mastered your flexion, you'll now do abduction. O, di ba? As in, the very easy one, nilagay ito yan. Ang dili sa ato niya, ubos na nga. Di ba? May modalities na kagano. That's why, siguro dahil matakan, manggid. Okay, let's say, in 1 month, kung natahan past tense, kag umamo lang na, wala na gidaiban. Outside the Philippine setting, yeah, based na sa mga ganan nila, ang ginay mo nila, flexion lang hanay subong, the next. Tapos subong abduction lang, mga mo si patient nga, I feel pain. You can introduce now your tense. So si tense, wala na tayo na ginabutang. So how do you feel? I feel relieved. So, pwede mo na tayo ma-endorse. So, pwede na, gano'n lang sa mga entrepreneurs na natin sila. Mabaligyan ako mo sa tense. Pero, you come back on Friday, I'll show you how to set the parameters. Meaning, mabalik siya sa Friday, ang session nyo is just to teach the patient how to set the parameters, how to put, ang mga ganyan, hapos-hapos lang yan ito. Sa the Philippine setting. Pero kasi that's for the geriatric. Siyempre, kung mga adults yan, hindi mo niya muna utay-utay siya yan. Oh. Kaso very, pwede kid. Kaso very dutay lang niya ang super tutok in the geria. Pero sa the Philippine setting, it pays a lot. There, for frequency, so for aerobic, you could do that 3 to 5 times a week. For skills, since it would need repetition to master the skill, so it's daily siya yan. And also for beginners, daily masya. For again, shorter duration. Stretching, syempre, mas better if you do it every time, especially before and after the activity. Strengthening, so very limited lang siya because you would need recovery in between. Okay? If you still remember your exercise bouts, di ba? May mga RM pala. Anong RM gani? Si RM. Sino? Hindi gani si RM sabihin. Your repetition maximum. Diba? How do you get RM? Anong maximum niya nga ma-do? Or usually, diba, do 10 repetitions tayo kung sa aton. So let's say 5 kilos. Ang 5 kilos na mag-do niya in 10 repetitions. Pero ano yun yung criteria ta? Para mahambal ta nga amoy ng RM niya. Hindi, anong, like paano ito mabalaan nga? Okay, RM na. Sabi, let's say 10 kilos. 10 kilos din. 7, 8, 9, 10. Day meaning 10 kilos, akong 10 RM. Na-complete ko 10. Hindi. Nakaya ko 10, di ba? 10 repetitions. So 10 kilos, akong 10 RM. Okay, kaya. Yes, ang nag-mean ko ang factors. So, di ba dapat ang factors na is complete range. Check. No pain. Check. Wala compensatory. Wala compensatory. Hindi ba sa 9? Wala 10. Dapat no compensatory. So, shoot mo siya. Ano ba yun? No, Valsalva maneuver. Diba? And, ano last time? If you still remember. Isa pa magawa ko na. 9. 10. No muscular tremors. Diba? Unang criteria. Hindi mo ito hang bata 10 kilos. Kung 9. 10. So, duwa na nang wala. Substitute motion ako, nag-valsalva ako. So, hindi siya consider dapat. Meaning, ang 10 kilos is too much for my right na shoulder. Kinado ko siyang 10, pero somewhere along the way, nag-valsalva ko. So, dapat clear to siya ang 5. So, dapat na perfect ko siya ng 10. Wala yun anything. No pain, atong criteria. Ha? Why no? Di ba? Gusto nyo sulit na nilis stress. Wala tayo ka-apply sa no pain, no gain. Pelita, sir, isa na lang gid. Ang sakit-sakit na isa na lang, sir. Hindi pwede, ha? Okay. Sige. For skills, usually 20 to 30 minutes daily, kaya for retention siya. So, mas galawig ta. So, patience na sulit-sulit as na ma-master ni patient. O, diba? I still remember your Oxford and your Delorme. Sige, si Oxford is... Sino ang increasing? Sino ang decreasing? Oxford is? Decreasing. So, Oxford. Huwag ka mag-abag, Oxford. Ikaw naman, si Delorme na ang increasing. Hindi ba there's no way for us to tell kung wala ka. So, based na lang siya sa pronunciation. Si Oxford, wala ko siya. So, decreasing load. 3 sets, that's why, di ba, very important si RM. Ako, I do this, kaya very effective, yun siya. Kasi may iban, di ba? Especially if you're, let's say, a team. Hindi ba into sports? In a team, I won't expect na kung magkakabuat, si Richard na 20 kilos, makaya mo na i-rate 20 kilos automatic. That's why, di ba, isa-isahin siya yan. You have to assess. Ang muna-munang wala, gina-check sa coaches, kiila, para dasi, pat ka mo na 20 kilos tanan. Tapos magka the next day, let's say may muscle tear, si Ray, o si Justin, yan nagkaladoms, for si Richard, yan is okay na okay. For example, let's say Clay. Kasi sa nice din. That's why, di ba, it has to be individualized. This one. So again, si Oxford, sa ato, sa PT, usually the 10 reps lang tayo. I'm not sure sa gym, 12, one dozen. Pero sa ato, the 10, sa ato, sa PT, 10 reps, 3 sets. That's okay na siya yan. Pero I'm not judging, especially for those who go to the gym. You do you, yeah. Nakawa na siya. From sa ato, for patients, yeah. So, manil. 10 reps, 3 sets na. So, si Oxford usually is, if pag-assess ta, nakita ta, mas dasing makapoy. lesser endurance. So sa first set, gina-maximize na nangadaan. That's why it's 100%. And then the second set, 75%. Third set is 50%. And then see the lower, that's your increasing. So let's say nakita nyo okay si strength and endurance. So that's why you increase the load. You start first with the 50, and then go progress to 75, and then 100. So again, wala na taga duck break. So like the very complicated is the duck break. For this one, you could use gidya sa kay patient. Okay? So pwede man also nga for beginners, you start with body weight ng anay. Again, do not forget always your warm up before and your cool down after. Especially Jerry, niya. Okay, so types of exercises. Miss, wala pa tayo exercises ka Oh, your aerobic exercise. So before, tawag pa aerobic exercise, so may mga clearance ito kanina, di ba? So you can have the patient undergo your exercise stress test. That's a gold standard. I know very common ta, exercise stress test. If you can still remember. Cardio. Your?
6-minute walk.
Your 6-minute walk test. It's exercise stress test ta. For ETT, di ba? Ang testing ta. Sa treadmill, what do you call that? Sita, di ba yung Jack niya? Sa treadmill. Charades, 2 words. First word, 1 syllable. Second word, 3 syllables. First word. Ang name ni Batman.
Yeah, Bruce.
Bruce Protocol. Di ba? Pwede yun. Di ba yung Bruce Protocol? That's the most common exercise stress test. Ang araw siya pala sa treadmill. Para ma-clear tayo especially yan. And then makamatama na incline. For 1-2 minutes. There. Diba? And then, determinate na kung onset of symptoms. So, quick lang. So, these are requirements on to when we will stop. Progressive angina. Okay, so dito yung magamba normal. Ang nag-sir kay Kapoy, mag-give-in-take ka. Okay, very subjective ang angina. So, meaning chest pain. And then pag-rest, okay, so again, try to differentiate your stable from your unstable. So, stable if, how do you know it's stable angina? Relieved by rest or medication. Ang unstable, wala siya kaka-relieve by rest. Hindi siya medication. Significant drop in systolic pressure. Ano ganit dapat ang normal response for exercise? Increase dapat ang blood pressure, even your heart rate. Kung nag-decrease, automatically stop. Okay? Lightheadedness, confusion, pallor, cyanosis. Again, do not try to be objective. Subjective, di siya hindi sir, okay na naman, nakalabi na mao, kanina. Do not try to justify for the patient. Pagkamali si patient, nakapoy na mo ya, stop na, stop gid ya. Okay? Sige, excessive rise in blood pressure. Sige, quick review, BCS1. Ano lang normal increase dapat? That will tell us nga, okay. 20 to 30 max ang pagani. For 20 will be the same. So, if 100 ang resting, tapos nag 150, maano ka mo? Stop. If 90, nag 110, okay na. Pwede normal effect siya. No increase in HR. Dapat ano ang normal response? Ma-increase siya dapat. All vitals technically should increase. Okay, changes in heart rhythm. Okay, makita tama lang sa ECG. Okay, diba that's why the stress testing. Okay, if you can see mga fibrillations. Siyempre, ang nini. Okay, patient has rights also. Kung isa po okay, ina-iya, vital. Sir, okay ma sir, okay, yung heart rate, huwag naman dagi na hapo, huwag naman cyanosis. Di ko hindi na kayo, okay. Subject wishes to stop, do not force. Wala tayo tilitay, ha? Eh, pwede ka na, outside the Philippines, the patient could sue you for harassment. Why do you need to force me to do something I do not wish to do? Diba? So, pwede ka ginayakasuhan ni patient. Sige. Observe or reported symptoms of severe fatigue. Okay, so meron iba na patients in denial. Hindi kaya ko niya, bro, ikaw mismo nakita mo nagiging may visible signs. May cyanosis, pallor, Okay? Sir, ka palang gitong ka na gidya. Hindi kaya ko niya. Or sa bilapsi lang gid kuya. O, diba? Okay. Sige, aerobic exercise. So that would include na, ako na ni-short yung mga 6 FWC. Your 6-minute walk test on this one. So that measures na how far the patient can go. Or you have your 400-meter walk test. Okay, so pwede siya either of the two. You can have it with the time, which is the 6 minute, or you can have it with the distance, the 400 meters. Pero very seldom you see 400 meters time. Okay, so again, prior to doing this, do proper warm-up, and then do proper cool-down after. Still remember, parin na siya gyapon. Very important na ni siya now. So, MHR is 220 minus age and then your carbonate formula. Pero, ang 60 to 70 is for healthy. So, usually, kumiyara na mga deconditioned, how many percent? Ang deconditioned. Ay, wala mo 20? 50?
45.
Save, diba? Healthy na 60 to 70. And then the condition is 40 to 50. Si cardio pulmo, within 40 to 60. It's the same lang sila. Pero si Katie, when we say, di mo yes, pasok man si the condition and si cardio pulmo. Si cardio pulmo, we have the minimum and the maximum bed. As we could check. So meaning, hindi na siya maglubog sa 40%, hindi na siya maglago sa 60%. Okay? And that one. Sige, again, for carbonance formula, it will differ depending on the current status. So again, your intensity, if you really need to check, still the same. Hindi na ko makakompute sa inyo, makakabala na ang math, ang interest na subong, kasi, ang dad ni Miss Jalay, Miss Angeli, hindi ba doon siya nag-cabbage? So, kapag treatment na siya also for FWF. So, kaya, di pa compute dito kay Tim's group. Kasi may pila ka percent, di ba? So, dapat kabalo ka mo nga 40 to 60 for cardio. And then you really need to check. Because during the course of the treatment, dapat ina-check niyo yan, let's say for example, 67 na siya. Dapat ang iya nga beats per minute with your heart rate lang yun is between 106 to 122 lang yun. Every time. That's the importance of the food. Sige, this one still the same. We've already discussed this one sa BCS tuta, duration, frequency, so daily, especially for poor functional for beginners, every other day. The same lang siya. So, contraindications lang yun. If the resting heart rate is greater than 100 beats per minute, that's resting pa lang. So how much more if may exercise ka pa? Systolic blood pressure is greater than 200 and the diastolic pressure is higher than 120 during the naiya or after the exercise. So greater than 120, so hindi na siya. Aquatic exercise is also a form. So how many have a advantage lang kasi you can have it in a group. Okay, and then we take advantage with the properties of water. So indications, so may mga OA, obesity, on that one. Fear of falling, kasi pagtupat nila yan, tubig lang. Pero wala na galing, if hindi ka balo, wag nabuhay si Lolo or si Lola. So again, risk for drowning. Okay, on that one naman. Sige, and then that one, still the same. Go back lang sa aquatic and hydrotherapy, so mga contraindications. So strengthening could be limited lang, so there's no need for us to use barbells, kettlebells, mga muna, or ang may mga lats pull down, yan. Okay, as simple as mga weights lang yan. Stretching, so again, does it have to be, lolo, dapat malapot, hindi mo ankle, because not all are flexible. Diba? Even kung at your age, not all one can reach. As long as you do proper warm-up and cool down. That one. So there. So, here to check for flexibility, as simple as your aptly stretch test. How do you do your aptlies? Sa likod ha. Then the other one. Asa? Oo. May mga flexion. O muna na yung kaya ni Lolo, ni Lola. O muna na ha. For this one, in-outward na lang na ang base of support. Kaya with the feed ball and stable siya. So yung stretchings that you can do on this one. Okay, these are the most common posture, just like your forward head. So this shortened muscles are your suboccipital. Lengthened are this. So what you can do is punching tucks. As simple as umulan na. Especially, di ba kauna na sila usually. Mas two posture, forward head. Especially pag ito may mga osteoporosis and Parkinson's. Plyometrics, very seldom. Because usually, di ba, dapat for athletes din. Pero if they are really conditioned, they're still into sports, di ba, may mga instances, may mga triathlete, may mga triathlon, kaya, so pwede sila yung punya ka, plyometrics. And ang most advised, your Tai Chi. So si Tai Chi ang mas highly recommended because aside from all the stretching, aside from mobility, so we are siya mental focus. So siya ang in-identify also with World Health Organization and CDC. Because diba daw, outside the Philippines, I think there are more instances of dementia, Alzheimer's. With this one, Tai Chi is a group activity. So they get to socialize. Unlike kung wala ka Tai Chi, diba uso sa sagwa, mga ginabili ng mga parents sa mga care homes. Unlike, kamo naman ang advantage sa Philippines, kasi we have very close family ties. So si Lola, guys-start pa with us, or may mabantay, hindi makuha tayong manugbantay. So ilan, ginabili lang nila sa care home. So that's why mas greater instances for Alzheimer's and dementia. These are just example according to EBP, evidence-based practices, ng mga recommendations on what the patient can do for strengthening endurance, balance, and task-specific siya. So later on, during your my internship nyo, or some of your case prep, you could check pwede nyo hindi magamit. Kaya ano siya, this is sa ato man yung reference books. Very specific. And we are done. Hashtag RCA Connect on Facebook. Wala na lang, Twitter.